I'm Dr. Ellis. I've practiced internal medicine for over 45 years. At 73, I don't just treat illness, I try to prevent tragedy. Among older adults, dizziness is the most dangerously underestimated symptom I see. Patients tell me, it's nothing, just age. But I've watched this quiet symptom lead to strokes, fractures, and irreversible losses. Dizziness after 60 isn't minor. It's your body begging you to listen before it's too late. Each patient I've lost to just dizziness left behind regret and silence. That's why I'm speaking now, not to scare you, but to warn you. Listen before it's too late. Let me tell you exactly why dizziness deserves your full attention. Because if you ignore it, you may not get a second chance to act. Section 1. Low blood pressure. The quiet collapse. Henry was 72, fiercely proud of staying active. He noticed slight dizziness when rising from his chair but shrugged it off. One afternoon, standing from his garden bench, the world spun violently. He collapsed, fracturing his hip. His independence vanished overnight, taken by what he thought was nothing. Orthostatic hypotension is common after 60. Aging arteries stiffen and heart reflexes slow. Blood can't move fast enough when you stand, briefly starving your brain of oxygen. The result? That quiet, dangerous sway. What makes this so serious is that it feels harmless until it's not. That subtle dizziness is a warning from your cardiovascular system, not a random annoyance. Ignoring it means gambling with your stability, mobility, and life. Have you ever felt dizzy standing up? Don't shrug it off. If this sounds familiar, it's time to act. Share your story below. Your experience could help someone else. And don't forget, subscribing keeps you informed and protected. Section 2. Cardiovascular disease. Heartbeats gone quiet. Cardiovascular disease. Heartbeats gone quiet. Patient story. Eleanor, a 68-year-old grandmother, started feeling lightheaded during her daily walks. Just getting older, she laughed. One afternoon, she fainted in her kitchen. Her husband rushed her to the ED. The diagnosis: atrial fibrillation. Her heart had been skipping and fluttering silently for weeks. Scientific explanation: cardiac arrhythmias, such as atrial fibrillation, reduce consistent blood flow to the brain, triggering dizziness or fainting. After 60, the heart's electrical system becomes vulnerable, making these symptoms early warning signs of stroke, heart failure, or cardiac arrest. Dr. Ellis's reflection. I still recall Eleanor's uneasy smile in my office, brushing off her spells of dizziness. Her body was already waving red flags. When the heart misfires, it doesn't always hurt, it unsettles you subtly. But those flutters and faint spells are far from innocent. Section 3. Neurological degeneration, the silent thief. Patient story. Robert was 74, a retired professor known for his sharp mind. He noticed mild dizziness occasionally, dismissed as fatigue. Gradually, other symptoms crept in: shaking hands, slow movement subtle enough to ignore. Eventually, diagnosed with Parkinson's, Robert quietly told me, "I knew something was off months ago, but I was too afraid to face it." Scientific explanation: dizziness can signal neurological degeneration such as Parkinson's or stroke risks. As the brain ages, nerve cells degrade, disrupting the delicate balance systems that control movement and coordination. The body adapts quietly at first, masking deeper decline until the system falters visibly. What seems like clumsiness or mild fatigue may in fact be early signs of neural compromise. Dr. Ellis's reflection. Robert's quiet fear prevented timely intervention. Dizziness linked to neurological decline isn't just inconvenient, it's your brain's whispered warning. Listen carefully. Your mind depends on swift response. If you've felt off balance or noticed a change in coordination, pause. See clarity now, not regret later. Your awareness today could be your protection tomorrow. Section 4. Vestibular decline, inner balance, quietly lost. Martha, 71, stopped attending social events, quietly withdrawing because mild dizziness left her fearful of falling. Soon, her world shrank to her home, loneliness deepening as dizziness limited every step. Examination revealed significant vestibular decline, a silent deterioration of her inner ear balance system. Vestibular degeneration occurs naturally with aging. Tiny hairs and fluid chambers within the inner ear lose sensitivity, impairing balance, spatial orientation, and increasing fall risks dramatically. Without this system functioning properly, even standing upright can feel unstable. The resulting fear leads many to avoid movement entirely, accelerating physical and emotional decline. Martha's isolation still saddens me deeply. Inner ear decline often goes unnoticed, quietly eroding independence and quality of life. Dizziness can silently imprison you, don't let it. Early diagnosis and targeted physical therapy can help rebuild stability. Vestibular rehabilitation can retrain balance pathways and restore confidence in movement. When dizziness begins to dictate where you go, who you see, or how you live, stop and act. Don't accept isolation as the cost of aging. You deserve to live fully, to walk confidently, and to remain connected to the world around you. Never underestimate the impact of something as quiet as imbalance. It whispers at first, but if ignored, it takes away more than you imagine. Section 5. Medication side effects, hidden dangers in daily pills. Frank, 69, suffered mild dizziness every morning. He blamed his age, not the multiple medications prescribed for arthritis, blood pressure, and cholesterol. When dizziness worsened, Frank fell, breaking his wrist. Reviewing his medication, I discovered drug interactions quietly worsening his dizziness preventable with proper attention. As we age, our metabolism changes. The liver and kidneys, organs responsible for processing medications, slow down, making older adults more sensitive to side effects. Many commonly prescribed drugs, such as beta blockers, diuretics, sedatives, and even some over-the-counter painkillers, can cause dizziness by lowering blood pressure or affecting the nervous system. Polypharmacy, taking multiple medications, is increasingly common in seniors. But the more pills you take, the higher your risk of dangerous interactions. Frank had no idea that combining his blood pressure meds with his sleep aid was creating a silent storm in his body. No one had explained it. No one had reviewed it. Until it was too late. Frank trusted blindly, quietly enduring symptoms he didn't understand. That fall changed his life, weeks in a cast, months in rehab, and a loss of confidence he never fully recovered from. Never accept dizziness as normal, especially when medications are involved. Question, review, and advocate fiercely for yourself. Your life depends on it. Section 6. Dehydration and nutrition-related issues, silent starvation. Agnes, 75, rarely drank water. "I just don't feel thirsty," she'd say, shrugging off the growing fatigue and subtle dizziness that began to shape her days. At first, she attributed her forgetfulness to normal aging. She'd lose her train of thought mid-sentence or forget why she'd walked into a room. "I'm just tired," she'd reassure herself. But slowly, her mental fog thickened, her energy waned, and confusion crept into daily tasks. Eventually, Agnes struggled to get out of bed. Her daughter found her one morning disoriented, unable to recognize her surroundings. At the hospital, tests revealed severe dehydration and multiple nutritional deficiencies. Her brain and body had been quietly starving. Aging dulls the thirst reflex and decreases appetite, especially for nutrient-dense foods. What seems like normal aging can actually be the slow shutdown of essential systems due to lack of hydration and nutrition. Dehydration reduces blood volume. impairing circulation and oxygen delivery to the brain, leading to dizziness, confusion, and even fainting. Nutritional deficiencies weaken immune responses, reduce muscle strength, and compromise cognitive clarity. For older adults, this creates a dangerous cocktail of symptoms that worsen silently over time. These effects are not rare, they're deeply common, yet devastatingly under-recognized. Anna's story is more common than you might think. When hydration and proper nourishment return, so too can clarity, balance, and vitality. But early recognition is critical. Seniors must prioritize water intake and balanced meals even when hunger or thirst feels absent. Don't wait until symptoms become severe. If your body's whispers are ignored, they can become screams that come too late. Be vigilant because the quietest declines are often the most dangerous. Final reflection, Dr. Ellis's urgent plea. Let me speak plainly. I've watched too many lives unravel, quietly, independence stolen, clarity lost, health shattered, all because dizziness was dismissed. Every patient you met today began with a subtle symptom, brushed aside as unimportant. And every one of them paid dearly for that mistake. Dizziness is not harmless. After 60, it is often your body's final attempt to get your attention before something worse arrives. Ignoring dizziness isn't wisdom. It's recklessness cloaked in denial. Don't let pride silence you. Don't let fear delay action. If your body is whispering, listen now. Ask questions. Seek answers. Intervene early. Because when it comes to aging, prevention is power. These aren't just medical facts. They are hard-earned truths from decades spent watching small symptoms become devastating crises. You have one precious life. Guard it fiercely. Respect the whispers. React to the tremors. Advocate for your health like your future depends on it, because it does. This is your moment to turn awareness into action, hesitation into clarity, and fear into strength. Dizziness may come quietly, but your response must be bold. You deserve nothing less.